All right, so I'm going to jump into our next set of presentations. We're delighted to highlight some practice-based projects and research within our state. And so first up is Jennifer D'Angelo and Melissa Danino, excuse me. Jennifer D'Angelo is the Senior Vice President and General Manager of the Healthcare Division at the New Jersey Innovation Institute. She is the leader of the Healthcare Division, which manages federal and state grant-funded programs focused on improving healthcare delivery. And Melissa Danino is a manager at the New Jersey Innovation Institute, also called NJII, with over 10 years experience in practice management and billing coding. And she was previously overseeing a multi-physician orthopedic rehab and MRI facility. So I invite both Melissa and Jennifer to share with us their work with practice-based projects.
Hi, good morning. How is everyone? Hope you're doing well today. Thank you so much for having us. Let me pull up the, will you be pulling up the presentation or will I pull it up?
Just give me 1 second.
Looks like Oliver has it up for you.
Perfect. Thank you, Oliver. Excellent, great. So we're going to go through
a little bit of who we are as New Jersey Innovation Institute, some of our New Jersey Health Information Network initiatives, and kind of walk you through the
process there and some of the use cases that we're currently working on. And then Melissa will take a deeper dive on some of the research that we've done with the practices. Great to be with you all today. You can go to the next slide. Perfect. So really quick, we're just going to do a company overview. So
I am Jennifer D'Angelo, Senior Vice President of the Healthcare Division, and have been working at NJII for approximately a year. I have spent my career on the provider side as a Chief Information Officer, focusing on health IT throughout my career, interoperability. So it's a bittersweet for me to be on this side, working at the state level for statewide interoperability and health IT in that capacity, but understanding the provider needs and challenges and abilities that they have to continue to collaborate in that perspective. So really happy to be with you. And I just want to give a brief update. I'm not quite sure if folks on the line know anything about the New Jersey Innovation Institute. So we'll go to the next slide and just do a company overview. So New Jersey Innovation Institute is a subset of NJIT. So I know many of you obviously are familiar with NJIT, state-owned university founded in 1881 with more than 11,400 students and over 160 million in research conducted annually. And that number continues to grow with the variety of research projects that we have. Earns highest ranking from Carnegie and ranked one nationally for student economic mobility by Forbes. So where does NJII fit into that space? We are owned by NJIT. We are a 501c3 corporation that was formed in 2014. We have over 300 million in revenue since we've opened our doors. Previously, the organization had worked on regional health exchanges. So we've had over a decade of industry experience supporting high-tech initiatives over the course of the years. We are located in Newark on the NJIT campus in the VentureLink building, and the organization is comprised of 6 core divisions. We have a biopharma, data and technology division, defense, entrepreneurship, and human capital management, healthcare being the largest division, and biopharma quickly picking up the pace there and meeting us in size and some of the initiatives that they're supporting. Thank you. So what really is our role in healthcare? How do we fit into statewide interoperability? How do we fit with healthcare organizations, and how does it really benefit the state of New Jersey and providers? So we look at ourselves as a really unique entity to improve quality, efficiency, and patient outcomes. We assist in design and support interoperability throughout the state, connecting providers to their patients and streamlining coordination of care. Although that happens a lot more now than it had been many years ago through a variety of different technologies with health systems, but looking at it at a higher level from statewide interoperability, that's where we come into play and start to connect providers to their patients through statewide integrations. We manage large-scale transformation and integration projects. We assist and help healthcare providers move from fee-for-service models to value-based service and payment models, and looking to do some advisory services, enabling innovation, transformation, and quality improvement. Our vision is maintaining our position and driving to continue to be a dominant force and revolutionizing healthcare through data-driven transformation and assisting with positive outcomes for providers and patients. And continuing to improve patient experience, improve population health, and ultimately reducing the cost of healthcare through data technology, metrics, interoperability, and really working hand in hand with health systems, independent practices, provider organizations to make health information available not only to providers and clinical teams, but also to hopefully streamline patient access for the consumer of their health information. As we all know and experience, we visit a variety of physicians, and each physician and health system may have a different portal that they're currently using. So we're working on technologies to hopefully bring that to a centralized area where consumers can access that information. So our divisional structure is very unique. We have on the left side the New Jersey Innovation Institute, which I have mentioned so far. And we also have a for-profit subsidiary on the right side called Healthcare Innovation Solutions. We refer to that as HCIS. And that is a for-profit subsidiary that was launched in 2018. All of our proceeds from that for-profit organization go back to New Jersey Innovation Institute, and we provide technology, advisory, and consulting services around quality improvement initiatives. We assist practices with MIPS registry submissions, hardship applications. We are supporting NJII, previously supported DISRIP for a number of hospitals throughout New Jersey, and continuing to add to those consulting services, staying in the healthcare space and looking at some new services with PCF, utilizing that MIPS registry that we are certified in. Our work is primarily funded by the New Jersey Department of Health, New Jersey Department of Human Services, and CMS. I think it's really important that we just take a minute to acknowledge where do we get our funding and how do we receive funding. So on the NJII side, we receive our funding through grants, and these are our partners that we currently work with to be able to support, maintain the health information network for the state. Some of our association partners that we have been working very closely with over the years, NJII, NJII, NJHIMSS, HCANJ. We also work with Leading Age. We've been doing quite a bit in long-term post-acute assisted living space with some of the mandates in the state. So we are continuing to expand those relationships and partnerships. So highlighting just some of our current programs, we offer the Medicaid Promoting Interoperability Program, which was originally Meaningful Use. We have a Substance Use Disorder Treatment Provider Promoting Interoperability Program. And if you can all say that very quickly, it's a mouthful, so I pause at that. We provide connectivity to the Immunization Information Systems Registry, and we assist providers with being able to onboard and access that system. We've assisted NJIT with COVID testing for the students, faculty, and specifically the athletics department so that they can continue with their seasons. We offer consulting services. Additionally, we are branching out to offer services for primary care first. And the uniqueness of our organization is that we are the state appointed entity for management and infrastructure for the New Jersey Health Information Network, which I will be referring to as NJHIN throughout the rest of the presentation. Some of the healthcare impact that we've had to date significantly looks at savings in CMS for the GPTN program with over $180 million. We have over 13 million patient lives that have been impacted by provider improvements as a result of that program. Over 100 million in incentives earned annually by our client providers through the MPP program. We have assisted organizations and providers to avoid over 25 million in penalties annually through the MPP and MIPS registry. We have over 8,000 providers that we have assisted adopting technologies and upgrading their EHRs through the New Jersey High Tech program. Over 1,500 providers have demonstrated meaningful use through the use of their EMR. Our SUD treatment providers working towards updating and adopting new technologies. We have millions of real-time visit alerts for the acute care facilities, which I'll take a deeper dive in a few moments in the presentation, and continuing to work with over 1,000 now healthcare providers to meet the NJII state registry requirements. So next I'll take a deep dive into NJII just to give an overview of what that information network looks like, what are some of the projects that we're working on, and some of the use cases. And if anyone at any point is interested in participating, my contact information I'm sure will go out at the end of the presentation. Please feel free to contact me directly. So the New Jersey Health Information Network was designed to reduce medical errors, improve data quality, and make healthcare more efficiently and available while improving patient outcomes for New Jersey residents. So a little bit of logistics. New Jersey Department of Health owns the HIN and the data that resides in the HIN, and NJII is the designated entity to manage and monitor HIN activity, use cases, expansions, and connections. So currently to date, we have all the acute care hospitals in the state. We have several health information exchanges, 4 regional health hubs, physicians and care teams, with the most recent mandate for the state, long-term care, assisted living, post-acute organizations, providers, and non-hospital facilities currently contributing to that network. We are the only network, we are the only network in the state that is able to connect to the statewide registries. And one critical component that really want to focus on is maintaining the correct information for the correct patient and doing, master person index matching throughout the state. So assigning patients a common key identifier, which I'll talk about also. So some participation benefits of being a member and a trusted data sharing organization of this health information network. We assist with compliance for federal and state mandates. Currently, by participating, we've supported the Cures Act with information blocking. We have CMS patient access final rule with ADT notifications that we support through our connectivity, and also supporting long-term care emergency operations center with Assembly Bill 4476 for facilities to join the New Jersey Health Information Network and also contribute bidirectionally admission, discharge, transfer, and CCDA notifications. So other benefits: patients, consumers, families, providers, hospitals, non-hospital facilities. It's really making health information at the state level available to those that need it when they need it, and in a timely fashion. So current participation stats, we have 11.9 million records in the Master Person Index. We receive over 3 million notifications per month and 121 million notifications per year from our organizations that are participating. We send approximately 70,000 admission, discharge, transfer notifications per week, and that number continues to grow as we onboard over 600 long-term post-acute assisted living organizations. And we have over 3.1 million notifications that go out each year, matching active care relationships with the proper recipients. to give you a very high visual of the connectivity that we have. So you'll see the health information network in the center. Some of the dotted lines are projects that we currently have in progress with connecting to health plans and pharmacies. But on the left-hand side, you'll see the activity with our trusted data sharing organizations, and that includes acute care facilities, hospitals, providers, HIEs, ACOs, regional health hubs, and those that we serve on the left. And then you'll see the statewide registries and entities on the right-hand side. So your provider directories, your IAS system, and a variety of other statewide registries, along with the master patient index. Some of the use cases and services, this is a very quick overview. I'll actually, in light of some time that we have to make up here a little bit, I will skip over this slide because we'll go into the registries and the use cases a little bit more in the next slide. So here we have our ADT alerts, and that includes patient demographics, diagnosis, insurance information, pretty standard alerting, but we have that ability to do that with all our trusted data sharing organizations and those that provide our active care relationship services files, which we call an ACRES tool. It assigns patients to providers and documents how providers would like to receive their patient information. We also have a provider directory, which is the National Provider Identifier, and that utility is increasingly valuable as we continue to adhere to the rules for interoperability and requires payers to make that provider directory available. Our CCDA is a use case that we really have expanded significantly in the past year, especially since I've been here, with organizations now participating to send that consolidated clinical document architecture. So that's in addition to admission, discharge, transfer messages. This allows us to get a little bit more clinical information that's being able to be passed through, and that again is shared at the statewide level. We spoke about master person index and having that be the single common identifier that labels every patient so that that number can follow that patient, and we ensure that the medical records are tied to the correct patient at all times. And that really is, you know, for those on the line that would like to take advantage of utilizing that use case, please contact me because that is tremendously valuable. That's been a long-standing barrier is patient identification within our own systems as on the provider side, but then at the state level, it's just such a critical component of making sure that we ensure the proper portability of that health information. We are currently working on enhancing EMS registry and associating EMS encounters, again, tying it back to the master patient index, and then defining the approach on how to retrieve that patient information by ingesting that MPI. Some other use cases, we have MPulse that we've partnered with NJII, and we've been working very closely with them on offering that to acute care facilities, long-term care facilities as well. We are assisting with the perinatal risk assessment and making enhancements to that, helping physicians onboard to IIS, connecting to the lead registry, and developing new systems and workflows that work around that registry within the CDRSS system. We focus a lot on fetal birth and death with outreaching and onboarding hospitals to identify and collect the appropriate data elements, again, and transferring that information to the very system at Department of Health. And then, as I alluded to before, the Consumer Access Project, which is recently launched, where it gives the consumer the ability through an open API to access their statewide health information for those facilities that are contributing to the health information network. Now I'm going to turn it over to Melissa Danino to take a deeper dive on some of our most recent projects.
Okay. Hello, everyone. As mentioned earlier, my name is Melissa Danino. I am a manager of the healthcare division and currently work on the New Jersey Health Information Network. Previously, I worked on the Garden Practice Transformation Network grant in order to help achieve facilities and providers go from fee-for-service to value-based care. Next slide, please. Hit it one more time, please. So I'm sorry. A little bit different than what mine was doing before. Our transformation coaches were trained to provide innovative strategies to practices and to help implement the Healthy 2020 initiatives. We were given a grant to assist 11,500 physicians be able to transform from fee-for-service to value-based, and actually were able to achieve over 12,000 physicians being able to meet that objective. We prepared them for the value-based care world, which resulted in efficiency-driven and 179 million through the fall of 2019. We developed core competencies in practice transformation at no cost, improved health outcomes, and better coordination of care for patients, implementing care coordination and care coordinators via the NJII, and we're able to have closer alignment with new federal policies and incentives. Next slide, please. One more time. So the approach of the Garden Practice Transformation Network and the TCPI initiative from CMS was to assess the practice. This was given with a practice readiness tool and an assessment guide, depending on whether or not you were primary or specialty care. It went over practices, technical systems, their EHR systems, the capabilities and processes, along with the baseline and current performance data from their key performance indicators, which our coaches were taught and how to extract all of that data from the electronic health record system. We would collect that data from the registries, from their EMR, from the patient's clinical quality measures and key performance indicators, and be able to prepare a gap analysis and a quality audit in order to see where those deficiencies were within the practice and help them come up with a work plan in order to make sure that they were able to improve those deficiencies and make them ready for that value-based incentive programs. We would transform those practices by implementing those systems and create capacity for routine performance reporting and new revenue models. Practices and workflow mapping to enhance quality care and efficiencies by using asset-based approaches. Those practice key performance indicators and CMS milestones and a progress towards goals, as well as providing feedback on those results. The transformation coaches would then sit in with the office. We would talk to the managers or whoever was at the goal at that point and discuss the practice's deficiencies, provide them with specific recommendations, and have their team come in and have an open discussion on how we would be able to improve those goals. Next slide, please. One more time. So the practice drivers to transform practices and to achieve the triple aim. If you could hit it one more time, that little, there you go. We would get better quality. One more time, please. Better healthcare. One more time. And lower cost. Everybody understands and sees this triple aim pyramid very frequently, and it's continuous data-driven quality improvement and sustainable business operations were key to the TCPI initiative and Garden Practice Transformation Network. Next, please. So why were we doing this? Obviously, it was to improve patient care, reduce cost of care, and avoid penalties in the future. If you're able to hit that one more time, it'll come up with the deck for you to be able to see how we would be able to adjust the cost based off of MIPS with the low cost and high quality, giving you the capability of getting an upwards incentive payment when you were actually doing your MIPS reporting in that year. One more time. So my main topic of conversation right now is going to be basically the work plans that we would set forth with those practices, and they would go over things such as transitional care management, return on investment, as well as choosing wisely topics that we were discussing earlier. So transitional care management was a service that's provided to your patients who have medical or psychosocial problems that require moderate or high complexity medical decision made during the transition in care from inpatient hospital setting to the patient's community setting. In the past, prior to the NJII and the HIEs, the facilities would have to do hospital outreach within that 24 to 48 business hour time frame of discharge to make sure that they had contacted the emergency department, gotten that CCDA or whatever it might have been at that point. Sorry, can you go back one more time? It's okay. So how would the practice manage their discharges? How would they get that information moving forward? With the implementation of the New Jersey Health Information Network, we have been able to manage and have providers connect directly to us and make it easier for their care team in order to obtain that information without having to outreach and chase that information that they so often had to do. Now that information is directly sent to them via the portal or their EHR. In order for them to obtain that information, they get that ADT notification with the discharge summary with that CCDA, and they're able to see that patient within that timely manner. In addition to that, that would also help with their MIPS score because they were able to lower their cost of care by making sure that there were no readmissions into the hospital at that time. Those readmissions that occurred within that 30-day time frame would reduce costs and effectively decrease or increase their incentive and decrease their penalty. In addition to that, we would have the workflow of the TCM and go over those billing codes because the facilities are able to bill at a higher rate. Those TCM codes are at 99495 and 99496. Ultimately giving a 20% higher increase on a return on investment for those facilities just by doing their regular workflow with a couple of tweaks in order to make sure that they're seeing that patient within that time frame to reduce the readmission to the hospital. Also, we're implementing some, community resources for those facilities and those providers to be able to give to those patients so that they have a more consistent care team, and it's not just necessarily within the office setting. So that wraps up my conversation on TCM and the Garden Practice Transformation Network. If you do have any interest in joining the New Jersey Health Information, please reach out to Jennifer D'Angelo, as she will put you in touch with the right people in order to be able to be onboarded and partake into this program.
Thank you, Jennifer and Melissa, for that. We wanted to highlight the important type of infrastructure and the health information network that already exists in New Jersey, and how the New Jersey Practice-Based Research Network is meant to be here to help collaborate and facilitate and fit into existing models. In the interest of time, I invite anybody who had questions to actually put them in the chat, because I want to make sure that our next speaker, Dr. Alyssa Kozlov, has time. So I'm going to move into introducing Dr. Kozlov. And if we do have time later for questions from the audience for either speaker, then we'll do that.